Hello, everyone. Welcome to the town hall for the recruitment for the director of the Department of Human Services. The county really appreciates your interest in this process, and it's great to see you all here tonight. My name is Nick Bubb. I'm the Assistant Director of the Department of Administration. I've been assisting the county exec's office with this recruitment. I want to provide a bit of background, followed by some housekeeping remarks, and then we can get to hearing from our two finalists for the evening. For background, this is just one piece of the process. The county has engaged MGT, formerly GovHR, which is a national consulting firm, to help the county conduct a nationwide search for this position. MGT has been the county's consultant for the last year or so and has assisted the county with the Alliant Energy Center recent director recruitment, the Office of Justice Reforms recruitment, and the Highway and Transportation Commissioners recruitment as well. In doing their nationwide search, MGT engages in a number of outreach activities. They posted the position online. They posted in a number of specific industry publications. They also use social media to assist with their recruitment. MGT currently has 17,000 views on their job board with 8,000 monthly subscribers. They also frequently use LinkedIn and have over 50,000 connections. They also, in addition, use governmentjobs.com and Facebook to further aid in outreach to their search. After reviewing the applications, the county and MGT conducted multiple rounds of interviews to narrow the field, resulting in the two candidates we have here tonight. Our first candidate's here. Our second candidate will be joining us later in the evening. For housekeeping, all questions tonight will be coming from the questions that were previously submitted through the online form. This isn't a legislative proceeding where members of the public have the opportunity to comment and ask questions. We ask that all members of the audience remain respectful so that everyone can hear how the candidates respond to the questions. There were more than 60 questions submitted, so thank you everyone for your participation in trying to figure out how to do that, because we can't ask 60 questions to both candidates all night long. We looked for common themes and selected the most salient questions and ones that would be appropriate for a general audience. So each candidate will have the opportunity to answer the question separately. We've set aside roughly 45 minutes for each candidate, and then we'll take a short break after the first candidate. There will also be an opportunity for you all to provide feedback at the end of this process, and I'll talk more about how to provide that feedback once we've heard from both of the candidates. Lastly, we're recording this town hall and we'll be sharing it online somehow. We're not exactly sure yet, but we will be as soon as we're done. My next thing is I want to introduce David DeAngelis from MGT. He is the county's senior consultant, and he'll be conducting the interviews tonight. He's got over 30 years of government experience in public management and elective office. He's a former mayor of Muskego and a village manager in Elm Grove. And then just as a way that this is going to work, I'm just going to introduce both of our candidates tonight. My introduction sort of serves as a way to provide you some context as to why they're a finalist for this position, so the candidates don't necessarily have to provide that background, just as a way of speeding things up. Our first candidate tonight is Astra Ikumure. Did I get that right? Close enough?
Close enough.
I was going to ask about it, and
I was listening.
She's currently the interim director of the Dane County Department of Human Services. As the interim director, she supervises 11 division administrators and managers who oversee 842 employees and over 400 outside service contractors with a budget of $313 million. Prior to being the interim director, she was the deputy director of the Department of Human Services from 2019 to 2022. She has also worked for the Madison Metropolitan School District as a director of strategic partnerships from 2018 to 2019. University of Wisconsin-Madison as an assistant director of community networks and national partnerships from 2014 to 2018, and the city of Madison as a deputy mayor for public safety from 2011 to 2014. She holds master's degrees in business administration and public management and public policy with a social policy concentration and a bachelor's degree in political science, all from the University of Wisconsin-Madison. So without that, I'm going to turn this over to David, who's going to conduct all of our questions.
Thank you, Nick.
Ready?
Good evening, Astra.
Good evening, David. Thank you, Nick, for the introduction. Hello.
So
I'm not
as,
supposed to talk to you, but.
so we have 7 questions, well, we have 7 questions and then an opportunity for you to make any final comments. So
Sure. 7 questions,
7 questions,
45 minutes?
45 minutes.
Okay.
And you have an opportunity to say something at the end.
Okay. Okay.
So
I'm long-winded, so I'm like, okay.
we'll try to keep you apprised of time if we
Okay,
think it's
thank
going a
you.
little long. Well, let's start out with the Department of Human Service offers many services, and a significant number of these services are contracted out to community providers. Can you speak to your experience and ability to connect with community partners to build strong relationships? Many of these contracts vary in size and scope, so please speak to your ability to manage and strategically collaborate with providers of all sizes and abilities across our community.
Right. So it's, thank you for the question. It's a good question. As you beautifully stated in your intro, the Department of Human Services has over 400 contracted providers across the gamut of all of our different areas of policy and service. What we have done as a department, what I have tried to continue to do under my leadership is create space for engagement, authentic engagement around different topics of interest with the POS advocacy group, which is ebbs and flows between, I'd say, anywhere from 10 to 20 regular providers that attend those meetings and contribute. So that's one area. And that came out of the Baker Tilly audit that happened in 2014. That was one of the recommendations. So that's been in place since then, which is prior to my joining the department. As far as me personally, my background is lots of areas of managing relationships and partnerships, coming from the county, coming from the school district before coming to the county, and prior to that, managing relationships for the UW and also for the city of Madison. What I came in, my orientation to partnership, contracted relationships is really based on trust and regular, authentic, bi-directional engagement. So shared interest, relationships and partnerships. I think the best ones are built on shared interest and also authentic engagement and honest engagement and being transparent. So that's my philosophy as it relates to looking at partners, engaging partners, evaluating new partnerships. And so we've tried to do that. One way I've tried to build on that personally is making time to engage with providers in the community on their space and on their turf, and making like time to learn about how they deliver service, what their operations are, how their operations are set up. I've been to places like Anesis. I've been to places like Briar Patch. I've been to Days and spent afternoons and mornings. I've been to some of the shelters in Madison and learned about operations, had conversations with staff and teams, and invited candid, sometimes painful feedback about what it feels like, what it's like to partner with the department. Have made space and heard concerns around funding, long-term, short-term, contracting process, RFP processes and whatnot. And so what we do is we try to take that feedback and think about and build the feedback in meaningful ways into how we approach our operations and our service delivery and our processes as it relates to bidding out contracts and things like that.
Thank you.
Yeah.
So how might the Department of Human Services work collaboratively to engage with other parts of the service sector? For example, healthcare, public health, school districts, municipalities, et cetera, to ensure there is a systemic approach to solving larger problems within the community?
I think it's, first of all, having a deep understanding about the different systems that actually coexist in, Dane County, and local government and how they intersect. So, I think part of that starts with having meaningful relationships that are not just transactional, but also, grounded in a firm and solid understanding about and appreciation for how these systems work. I think that I bring that, having had a lot of deep experience, having been a part of multiple systems of government here. The only system I have not worked for is federal government, as it relates to governments and school districts and the UW system and whatnot. So I understand in a very intimate way how all of these systems work together. I think how we build authentic collaboration is having an awareness of the priorities and the strategy and approach of all of these different organizations, and inviting regular engagement and exploration on how we can come up with ideas to begin to build a collaborative relationship, and whether it's projects or whether it's shared programming or shared funding. So, an example of that would be, United Way is one of the backbone organizations here in Dane County. We have the early childhood zones. They're a major partner in that space with us. So we collaborate when it comes to funding. We collaborate when it comes to supporting other providers, even if they don't have a contractual relationship with us. We acknowledge that there are other practitioners in the human services space. For example, Boys and Girls Clubs, for example, Urban League. They have housing programs, they have employment programs that we try to support and complement, and acknowledge that we don't need to recreate the wheel in certain spaces. We can honor and uplift and support what's already happening in other spaces of the county and in other systems.
Thank you. How will you address the growing concerns of homelessness and the unhoused population in Dane County?
How will I personally address it?
How will you address that? Yes.
So I think the first thing is acknowledging the great work that's been done. We have a regional housing strategy plan that's been developed, and we also have a community plan to end homelessness, that both of which have been released recently in recent months. There's a lot of great recommendations around building up housing stock and also improving access to housing. I think the department, how I personally can support that is embracing that and encouraging our department, Human Services, to use that as a starting point as we use both of those plans as a starting point to conceptualize what our plan, how our investments will line up, how we will develop housing stock, how we will develop and think about shelter and access to housing and home and shelter in the coming years. This year, Human Services is in the last year of its current strategic plan, and we are simultaneously going to be building our new next 5-year plan this year. And so a lot of engagement and thinking will go into what will the next 5 years look like for Human Services, shelter, housing, housing instability, all of that will be a part of our strategic planning process. So I think as the Director of Human Services, I can embrace the great thinking and research that has already happened, acknowledge the work of the community, and advocates in this space, other practitioners in the housing and shelter space, and embrace it and promote it and find ways where we can intersect as a department with it and complement it.
Okay. Thank you. What
I
is-
want to look at you guys, so please don't take offense that I'm looking at.
You're doing good. You're doing
This
good
is so
splitting your
counterintuitive.
time, Astra. It's okay.
Okay.
To make it more complicated, the camera's up there.
Let's start over. Just kidding.
So, so what is your vision for improving outcomes in child welfare services in our county?
I think, first of all, centering racial equity and social justice. When we think about child welfare, disproportionately, families and kids of color are impacted in this community in real ways. I think we need to uplift mandatory reporting and making sure that we're training all of our different partners in this space. Anybody that serves children and families should understand what mandatory reporting is. I think that we also need to make sure that we are aligned in embracing families first philosophy that the state has pushed forward, and that we're aligned with that philosophy as well. And so, and also, I think about child welfare. When I think of child welfare, I think about our CPS team, our YJ team. I think about also our out-of-home care team. I think we also need to, one of the things that I have my eye on and am very concerned about is our foster care providers needing to build up that network of people, great people that provide foster care and temporary shelter for kids that are going through issues with their family environment and need a place to land for temporary and sometimes long term. We are, a lot of our long-term providers are retiring, and we need to build that back up. We need to be culturally competent and centered in how we recruit and train new providers and encourage, and we need to be plugged in with communities of color, marginalized communities in Dane County to encourage and invite them to be a part of our service delivery model. So child welfare for me, I think of social justice, racial justice. I think of sound program design, amazing. I'd be remiss to say I cannot overlook the practitioners, the social workers, the caseworkers, case managers in that space for human services, our partners as well that do that work. And we want to make sure that we're investing in great recruitment, that we're compensating our staff appropriately and competitively, and that we are also honoring that is our CPS, our YJ operation is a 24/7 operation. And so we need to be compensating them appropriately. And so to me, that's all a part of building a robust child welfare system on both sides, service delivery and also service recipients.
As seen in the 2025 budget process, the county's budget is tight and will likely remain that way in 2026. How will you address competing demands for service in a fiscally constrained environment?
I'm going to print money. Just kidding. It's really, yeah, the projection for fiscal outlook for the next couple of years actually is pretty bleak. I think this is actually always a challenge every year. Because human services, as big as we are, believe it or not, we operate very lean. And often it is an exercise of, our budgeting process often is an exercise of which bill are we going to pay? Which one are we going to put on ice another year kind of deal. And it's always a challenge. So I think what we do is we listen to the community. We look at our data. When we develop our budget for human services, we're always data driven. We also look at our strategic plan and what we've already called out as priorities in our strategic plan that have been informed by our staff, that have been informed. The strategic plan is also informed by the broader community and our POS partners, broader community advocates in the community. So that's our North Star. We look to that to establish priorities, but we're also looking to emerging. So we're listening to elected officials. We're listening to the priorities of the executive team as well, and trying to come up with a proposal, a package that feels fair and balanced and gets us to the next year, to the next budget cycle soundly. But I will tell you, and you all know this being in the room, there's always somebody that's not happy. And that's not, that doesn't feel good. But we do try our best to prioritize, come up with a budget package that reflects the needs and also the expectations of our service, our partners, and our community, our broader community.
Can you talk to us about your vision of leadership and how you will approach leading over 900 people?
Yeah, thank you for the question. I am a collaborative leader. Hi. I am a collaborative leader. I am a servant leader. I see my role as the leader of human services as advocating. I see myself as a support. So I always say my job is to cheerlead. My job is to block and tackle. My job is to elevate and celebrate. My job is to sometimes say no or not yet or not right now. And my job is to also educate. And what I like to do, when I say I'm a collaborative leader, it means that I want to make space for authentic engagement. And that means making space for dissent. It means making space for disagreement. I want human services to be a place where it is safe to disagree, but yet be heard. And it is safe to bring your full self to work. And I want everybody in human services, this is my dream, I want everybody to see themselves and connect to our values and our mission and our vision and see the great work and how it lands in the community. As I think about, the political wind shifting at the federal level, I think about what could happen to our services and our funding. And that we are Dane County government, human services will be a lifeline for a lot of people. And I think it's important, not just for who we serve, I think it is important for our team as a collective, as a department, to feel seen, to feel supported, to feel heard. And the ways in which I try to find lanes to do that is I try to create spaces for engagement. I encourage our division administrators and all of our divisions to have space to talk about employee engagement, whether it's with the employee groups, whether it's through developing surveys and cultural surveys we do to try to get a read on what's happening in the department and whatnot, and things like that. And also listening to what we're learning from our providers, our provider network and our POS community, what they're telling us, what they're hearing as well, and trying to learn. So I think it's humility. I think it's my leadership style is certainly servant leadership and being collaborative, and also making space for our other county partners as well. So the judges, making space for the DA's office, making space for the sheriff's department, and how we intersect in our work with them as well. So that's how the cookie crumbles.
So Astra, Dane County suffers chronic and worsening problems with access to mental health and substance abuse services. How can the county, how can the, how the county can, how can the county work to remedy these problems?
Um, there's a lot of ways that we can do that. First, we have to have a conversation and a real conversation about how to fund not only crisis, but our broader behavioral health investments long term. I'm thinking about the Crisis Triage Center RFP that failed because we were throwing pennies at $1 million problems. So I would be remiss if I did not acknowledge that we have to have a real conversation about how to fund these long term. There are our POS partners are valued partners in that space, but they can only do so much with not enough funding, frankly. So that's one of the things that we have to do. I will work hard to advocate for that. I have worked hard to advocate for that in the past in the interim position, and my predecessor has as well. And we'll continue doing that and having that conversation. What was the question again? Repeat it.
Sure. Dane County suffers chronic and worsening problems of access to mental health
Yeah.
and substance abuse
Yep.
services. How can the county work to remedy these problems?
I think also there was a report that came out called the Centerstone Report that we commissioned, Human Services commissioned with a national provider in this space. And there were a number of outcomes or recommendations that was made and this was specifically focused on crisis, but we don't even define crisis the same in this community. We don't have a shared understanding of what crisis means. We don't we don't collect data the same. There's a lot of the upside of this is that there's been a lot of great innovation in the last 5 years in the crisis space, but we're at a point where we need to look back and come together as different practitioners and systems that are in this space and look at the different models and find out how do we create a seamless system together around crisis. And that's really what the Centerstone report spoke to. What Human Services is advocating for as a next step is bringing in a third-party provider, facilitator, I should say, to help begin conversations over the next year and with our valued partners in that space, some of which are providers, some of which are other systems, some of which are other politicians and elected officials, to begin to explore how to collaboratively imagine a seamless system. We have extremes right now. We have high needs being met. We have low needs being met, but there's this continuum in the middle that's not effectively being addressed, that need. So I think to kind of put a bow on it, I think as director, that's what I'll be advocating for is bringing in that facilitator to actually have some authentic engagement and thought partnership as a community around crisis.
Yeah. So, Astra,
Yes.
this is your chance.
Did I answer all the questions already?
You did.
Oh,
You
man.
did. You were much more concise than you give yourself credit
I'm
for.
trying. All the people that know me out there are like, yeah, Astra's not known for being short-winded. So sorry about that.
So this is your chance to give us any final comments, anything you would like to add to any of the questions you've already answered, or if there's something that you feel is important that the public needs to know about you.
So first of all, yes, I'll take this opportunity just to say a few things. The first thing I want to say is thank you for the opportunity. Thank you for taking the time to shepherd this whole process this morning. I've been here since this morning, folks. There was a executive team interview, there was a board interview, and now I'm doing a town hall. So it's been a long day, but I thank you both for the effort in doing this. Let me say this, and if there was music on TV, it would cue now. I love this community. I am from Madison. I was born and raised in Dane County. I love human services. I love everybody in human services. I have a deep love for the work and the passion that human services staff bring to work. They don't get celebrated nearly enough. My mission is to celebrate them and elevate them and be the face of this department long term. I am proud of the work Human Services does. Um, the last 2 years has been crazy, but also the joy of my life. I love the work we do. I get purpose in it every day. We have hard conversations. We have passionate partners that are also doing great work. I do not like saying no. I wish I could say it less. I hope to say it less. But I don't, I want to know, I want everybody, especially our PLS partners in the room to know they are deeply appreciated. I see them. I can't always tell them what I'm fighting for on their behalf, but I'm fighting for them and their resources they need. I want to create, my goal for human services is that it be a place where everybody can feel appreciated and seen. I also want it to be a diverse place. I want it to represent and reflect the county, the people that we serve. That means imagining what our workforce looks like. It might look different. We get to do incredible work, fulfilling work, serving everybody in Dane County in one way, shape, or form. We are the crown jewel of humans of this county, I believe. People actually move to Dane County because of our human services safety net. I'm proud of that. My goal is to keep doing it. I'm gonna, anybody that remembers Emerald Lagasse from the Food Network, he used to say, turn it up a notch. I'm going to turn it up a notch. I'm going to ask for more of us, but I'm also going to fight for more resources to do that. So my goal, my vision for moving forward for this year is to build an incredible, robust, inspiring strategic plan for the next 5 years. It's also to continue and uplift the work that we're doing. It's also to make space for innovation and good ideas and authentic engagement in authentic spaces. I want human services to be diverse. I want us to be social justice centered. I want the disproportionality of our service consumers to I hope to I tell M team every now and then that our management team, I call M team, I tell them I want to work us out of a job, and I know that we're nowhere near that happening. But I would love for us to our customers to not be repeat customers. I would like us to be able to launch and springboard our and partner with our other human services agencies in this space, whether in the nonprofit sector, that are talking about home ownership and not just shelter, talking about investment in wealth building and not just surviving. We serve people on the bubble, and I'm proud of that we can be that. So there's no shame in that. But I hope that we can also be thinking about how do we launch people up and out and watch them fly, and then bring in the next group that needs help. So that's what I hope that we can be more solution centered. And we still have to have that emergency room focus, which we have, and do it very well, in my opinion. And so that's my vision. And this is a labor of love. I do this because I love to do it. And I love the people and I love you guys for coming out and listening to me tonight. So thank you. That's all I got.
Thank you, Astra.
Should I sing now? Okay.
Thank you.
I guess I don't take questions, right? I just
No.
go, okay.
Yeah.
Okay. All right. Well, thank you.
Thank you.
How many more minutes?
I'd like to turn our attention now to our second candidate. It's my privilege to introduce Amy Everett. Amy was most recently the Chief Operating Officer and Executive Vice President of Operations at Mind Springs Health and West Springs Hospital in Grand Junction, Colorado. In her role as the Chief Operating Officer, she managed 11 executives who oversaw a total of 525 employees with an annual budget of $68 million. She previously worked for the Colorado Department of Human Services, the Office of Behavioral Health, in various roles, beginning as the Women's Service Coordinator, and then in the State Opioid Treatment Authority, and then finally as the Associate Director of Adult Treatment and Recovery from 2017 to 2022. She also worked as a social worker at the Dakota County in Minnesota in the Jail Treatment Program and Chemical Health Unit. Amy has a master's degree in clinical psychology from Agrosi University and a bachelor's degree in psychology from Minnesota State University, Mankato. And so it's now kind of your opportunity to have sort of the same questions that we just asked our other candidate. And so I'll turn it over to David to conduct those interviews in just a second. Again, we've got roughly 45 minutes for today's interview.
All right, thank you.
Thank you.
Thanks everyone for being here.
All right. Good evening, Amy. We have 7 questions for you tonight that, as Nick mentioned, were submitted by the public. And then at the end of that, you'll have an opportunity to tell us whatever final comments you would like or anything that you would like to expand upon further.
Sounds great.
So first question, the Department of Human Services offers many services and a significant number of these services are contracted out to community providers. Can you speak to your experience and ability to connect with community partners to build strong relationships? Many of these contracts vary in size and scope, so please speak to your ability to manage and strategically collaborate with providers of all sizes and abilities across the community.
Absolutely. Well, again, thanks everyone for having me here this evening. I am incredibly excited for this opportunity to kind of share with you a little bit about my background and also hopefully touch base with a few folks afterwards about some of your hopes for the department going forward. But to start, I'll share a little bit of my experience working for the state of Colorado at the Office of Behavioral Health or the Behavioral Health Administration. One of the things I was responsible for was overseeing our contracts management related to behavioral health contracts, specifically for adult populations, but sometimes crossing into some of our juvenile or youth populations as well. So at the state level, we probably had over $200 million annually for my department in contracts that were issued out to providers. And so really focusing in on how are we going to use those funds to have the greatest impact and really establishing things in that way. Looking to see what types of providers were serving which populations and making sure that we had a diverse group and representation via contract administration. And then making sure that we were reducing barriers in the RFP process so that smaller providers who didn't have the resources for folks to support grant writing or other services also had an opportunity to make sure that they were at the table and equally as competitive as some of their larger counterparts. So that is one thing, but I think communication is a huge part of this. And so being in government, transparency is so important. And so making sure that early and often we're communicating with providers because that is really the call of the county. You're a pass-through for state and federal funds to get to those service providers. The county typically doesn't serve as a service provider, although there are some exceptions to that. But for me in this role, I would be making sure that we're making county service providers aware of those opportunities early so that you have a chance to get your applications in, work through the RFP process, bring up any concerns you might have, ask any questions to really develop a robust and competitive application. And then just really working with providers because I think, again, like that is the heart of what human services is doing, is trying to connect people to services to providers, and then providers to funding resources so that we can make sure that everybody in the county has access to the things that they need. Human services is typically a department people access when they're not having the greatest day or they're not in the greatest time in their lives. So how do we make that as easy as possible for people to access services?
Okay. So how might the department, excuse me, how might the Department of Human Services work collaboratively to engage with other parts of the service sector? For example, healthcare, public health, school districts, municipalities, et cetera, to ensure that there is a systemic approach to solving the larger problems within the community.
Certainly. So I think there has to be that systemic approach. The county is not going to be able to solve all of the human service related problems or problems at large that are impacting people and their ability to live self-directed lives on its own. This is a relatively large department for Dane County, but in the grand scheme of things, one, we can't do it without providers, but two, we can't do it without braided funding sources. So also looking to some of the expertise that comes outside the county from public health, from criminal justice, from Medicaid, looking to different payers, but then also looking to philanthropic agencies. There are a lot of different partners that can come together, and I would really make sure that we have strong relationships and good communication with those partners so that we're doing everything and seeking out every possible dollar we can to get the services to the people who need them to most and stretch those things as far as we can. Because again, we know that collaboration is really what's going to bring everyone together to support all of those who call Dane County home.
So Amy, how will you address the growing concerns of homelessness and the unhoused population in Dane County?
Certainly. Ooh, that's a loaded question.
Big question.
It is a big question. But I think the way I would start to answer that is I can't do it alone. And so the county can't do it alone. So very similar to my last answer, and I don't want to be too repetitive, but it's looking to those other agencies to understand how can we combine efforts so that we're not duplicating efforts. We're really combining these funding streams to take them and stretch them as far as we can. I will say that this is an area I did quite a bit of research coming into this position and recognize that several of the providers right now close their doors between 5 and 5:30, or they do intakes only between 5:30 and 8 p.m. And so that's something I'd be looking at is how do we make sure that one, that shelters and temporary resources are not the only resources in the county. We've got to have long-term stable housing because we know that that stability is what helps people create a foundation to take them to the next steps. So how do we look at that housing first model that's currently been implemented? And I know that, again, from doing some research, there have been some kind of hit or miss things with that housing first implementation. But how do we continue to see that forward? But again, pair the dollars with it so that funding is not the reason that that doesn't go through. So again, so the state departments, looking to other county departments, looking to the federal dollars that are being drawn down and where we can potentially see a federal match, and looking at capital investments. Because again, we have to start with housing first as a secure and stable resource and foundation to get people through to those next steps like treatment and recovery, or working through food insecurities, which I promised I would never say. So I'm going to correct myself. Working through hunger. Because I think when we say food insecurity, and this is just a tiny little soapbox I'm going to get on, food insecurity is a really vague term, but I think all of us can recognize what hunger is. So working through hunger and working through some of those pieces where we want to make sure that people have their basic needs met.
Thank you. So, Amy, what is your vision for improving outcomes in child welfare services in our county?
Yeah. Well, first, I want to acknowledge the good work that's already been done. I mean, the county between 2019 and 2023 reduced out of home placements or removals by 33%, which is pretty significant. That's a significant percentage. So, first of all, I want to recognize good work that's already being done. And so, how do we take that a step further? I think we look at preventative efforts. How do you take kind of a three-pronged approach to identifying families who may be at risk, starting with just community at large education, looking to those at-risk families, and then looking to families who have already been involved in the system, and how do we prevent something from happening again? So starting with those preventative efforts and then working through to ensuring that there's not implicit bias in any of our systems that are really engaging those families and again, making that commitment to restoring families together and having that be the primary goal, the primary outcome, and the primary focus, and working with them to give them opportunities, whether it be respite services or kinship placement, things that are an alternative to removal of children from the home. So those are some of the ways in which I would start to address some and continue some of the work that's been done.
Thank you. As seen in the 2025 budget process, the county's budget is tight and will likely remain that way in 2026. How will you address competing demands for services in a fiscally constrained environment?
Yes. So I think budgeting is always really difficult, especially when you're talking about human services, because we're talking about people's lives. We're not talking about what chairs and what furniture we're going to put in what office room. We're talking about the impact to real people who are really going to feel the outcome. And so in looking at some of those priorities and competing priorities, I would really look to you, the providers, to what are you hearing? What do we have enough of? What do we need more of? And what are the priorities of the county? So working with the county executive, working with the county board, but really trying to first set the priorities for the county level and then hearing what do the people need? What resources do we not have? What gaps are out there in our systems? And then in what ways can we braid funding or match funding, get federal drawdowns, get grants, use philanthropic organizations to kind of piece together some of the systems because that unfortunately is the way that government typically works. And so for me, that's being aggressive about it early on, understanding where we are already getting the funding coming in and what are some of the other opportunities and making those connections, making those calls, reaching out to some of the members at both the state and federal level to have those conversations. But again, coming back to what do those who call Dane County home, what do they want? What do they need? Because oftentimes it's not going to be me sitting in an office or the county executive or even the board. It's going to be the community. It's going to be providers. It's going to be all of you saying, here's what we truly need and what's going to take us further and what's going to truly have a meaningful impact. And then working to prioritize that and make sure that all of the voices are heard in that process.
Thank you. Amy, can you talk about your vision of leadership and how you will approach leading over 900 people?
Certainly. So you said it earlier, I currently oversee 525 employees up until very recently. And so I really look at leadership as a privilege. This is an opportunity that I've been given, and this is something that is more of a calling than it is a job or a task or something I took on. I approach leadership as a servant style leader, meaning that if there was a hierarchical pyramid, I flip it upside down. It's really looking at how are we taking a client or a patient first perspective or a human first perspective, looking at all the people who are receiving the services and needing this level or needing the care that's being administered by the providers, by the county, or whoever it may be. And then focusing in on that direct line staff who have those responsibilities, making sure that they're supported, that they're taken care of, that they have everything they need to successfully do their jobs. I said this earlier, but a lot of times we look to people as the problem. I look to process as the problem. I think that's more true more often than not. And so how do we look at process and process improvement? And from there, we kind of keep going down the pyramid to those mid-level managers who are often underutilized. And how do we empower them to be making these decisions and to be working with and motivating their teams? But then at the bottom of that pyramid is really the executive leadership team and me. And I know that as a leader, like my calling is going to be met and my team is going to be fulfilling their mission if we're always focused on that end user, that consumer, that patient, that client, that individual who's receiving care. And so that's really what I would kind of use to motivate my team. And oftentimes in human services, people have a lot of big hearts. That's why we get into the work. We want to be helpers. We want to help those people who need it in their time of need and the time of need they need it the most. But again, to support them and get them where they need to be, which is on that path to self-directed wellness, you've got to support the people who work for you and start with them.
Dane County suffers chronic and worsening problems of access to mental health and substance abuse services. How can the county work to remedy these problems?
Yes. So the county is unfortunately not alone in this. This is a problem we have across the country, and one that being a mental health clinician is very close to my heart. It's work that I've been doing for quite some time. And so knowing that this is one of the biggest bogeys in healthcare right now is behavioral health, so meaning mental health and substance use and or the combined dual diagnosis. But not knowing, how many more individuals we're going to have coming out of the pandemic and coming out of isolation, coming out of just the trauma of being alone and being unsure and being, just there's so much uncertainty in the world right now, as we've seen over the last few weeks. How are we going to support those individuals? And there is a lack of resources. There's a lack of individuals who are graduating from programs and becoming counselors. There's pay inequities. There's disparities between, medical care and behavioral health care. So there's a lot to tackle there. But how I would start with that is first understanding what current systems are in place, what's working, where are the gaps, and how can we bridge those? This was a question I was actually asked by one of the county board members, but how do we make sure that for folks who are sitting on a wait list for 3 to 6 months waiting for treatment, what are we doing for them in that interim time? Because we can't just allow them to sit on that list and give them a call that says, hey, how are you doing? I hope you're okay while you're waiting for care. They're not okay. We know they're not okay. They're waiting for care. And so making sure that we have some of those interim systems in place. What is the lowest threshold of care that they can engage in? Is it peer recovery services and working with somebody who has that lived experience to kind of walk alongside them and bring them to that next step? Is it case management and helping them identify resources? Is it getting into individual therapy? Or group therapy so that they don't feel like they're alone in what they're going through and connecting them to somebody who has that relatable experience in a group setting, and then going into those higher levels of care. But again, making those connections and then making sure we're working with state departments, including Medicaid, Medicare, and others, so that providers have the full array of services available to them and how to bill for those services that they're providing, because I think that's the other challenge. So again, it's that cross-departmental work that has to happen to make sure that as a county, we're supporting providers, but also as a state that we're coming together to support those who need services.
Well, that was the 7 questions.
Oh my gosh. Well, David, now everybody just has to get to know me.
Well, exactly. So now that, question number 8 is, do you have any final comments, any other things that you would like to share about yourself, about your vision for, human services? Now is your opportunity to do that.
Well,
Also, too, I'm sorry, I don't want to cut you off, but also if you want to add any other detail to some of
Correct.
the other questions, it would be your opportunity to kind of fill in there too.
Yeah, well, I will say my husband always gives me a hard time because I talk really fast and I'm fairly direct, and I hope that that comes across in a more meaningful way. But sometimes it just comes across as being a little short, and I promise you I'm not. I'm actually a very friendly, very easy to get to know person, and I want to be very approachable. And so, one of the things I always tell people is I wanted to get into that helping profession. I honestly thought it was going to be in nursing. And so, I did a few tours at the college level, went to a cadaver lab, and very quickly found out that was not for me. And so, I got into this behavioral health and getting my master's degree and then going into leadership positions because I wanted to be in a position where I was helping grow the next level and the next layer and the next generation of leaders going forward. So, really committing to my team, really committing to personal growth and development of the leaders who would be directly reporting to me and those directly reporting to them. And that's why I talk about that servant style leadership as being so incredibly important, because you want to know as people who are who this is important to, you want to know you're going to have good leaders going forward from here. It's not just about me. It's not just about other candidates. It's really about who's going to come next and how are we going to continue to execute on this vision by developing those people who are coming from underneath. And so another thing that's really important to me is how do we develop some of those leadership programs internally or externally so that we do see more people enter into the field and not be afraid of burning out and not be afraid of being held personally accountable for things they don't have control over. And, I think it's so important that we invest back in the teams who we're working with. And so that is something that absolutely as a candidate, you'll see from me. The other thing I think I would share with everyone is I also identify with transformational style leadership. If you are looking for a candidate who is going to keep things status quo and make sure that everything continues as is, I'm not your candidate. I want to see things grow. I want to see things change. I want to see how far we can stretch government to support the people who are living here. And that's truly my calling. So, working with teams through change management, working with teams on how we can continue to excel and become excellent and proficient in what we do, how we can save taxpayers' dollars, how we can do all of this while ensuring that we are safely and providing quality care to the people who are receiving the service from the county in a time when they likely need it the most. So that's just a few extra things I would share about me, but I'm still probably pretty short. I'm sure we all want to go home 20 minutes
We
early.
still have like 10 more minutes, Amy, so,
Well, like I told you earlier, I can tell you what I'm watching on Netflix, but I don't think people want to know that. So, but that's about all I would say. So I think as far as, my vision for the county is to really come in, embrace the other departments, embrace the team that I would be working with, really embrace the relationships with providers. I know there are over 400 contracts that the county issues out, really looking at making sure that all communities are represented, not just kind of keeping it centric to Madison. I know that that happens. I come from Denver. I worked in Grand Junction. For those who don't know, that's basically the border of Utah. And it's fairly rural. And so making sure that those voices are represented, making sure that marginalized communities are represented saliently, that is incredibly important to me and my family, that there are services for people who look like me and people who don't, people who look like some of our other marginalized communities. But also thinking about the LGBTQ community and how are we best serving them and making sure that they're safe places that they can access care. I could, like I said, go on and on about all of the issues and all of the things that I would like to see happen for the county. But I think walking away from this, I want everybody to know that like I am a connector. I see county as functioning as a connector of agencies to funding, to state, to federal. And just being somebody who builds up relationships because I think that's so incredibly important to successfully achieving all of the work that we're trying to do. So I'll stop there. Thank you.
thank you, thank you.
All right. Have a good evening.
So thank you everyone for coming to our town hall tonight. We do have an opportunity for you to provide feedback to the county executive. We've got some half sheets of paper over there for you and some pens for you to be able to provide some written feedback. If you would prefer to provide that feedback later, there is a QR code that's on top of that piece of paper that links to a form that is basically the same thing. It's literally the same exact words that you can fill out, on your laptop, phone, whatever, if you'd rather digest and do that at home or you just don't like handwriting anymore. And so that's available for you. We're happy to receive your feedback either way. The county executive will carefully review all the public feedback that we receive, as well as any insights gained during our interviews today and other evaluations of the finalists. Then it's the county executive who will nominate an individual who will then go through the board's confirmation process. But that's all I have for you all tonight. Thank you for coming out and listening to our finalist candidates. We really appreciate your interest in this and your interest in submitting questions as well. Thank you.
Thank you.
Thank you.
Oh, geez, I have no, I was so weird. Not even gonna guess. No. Yeah.